Asthma is a lung disease, so asthma medications must be given into the lungs directly. Thereby, oral medications are not that useful nowadays, not in practice globally. Thereby, there are three ways to give the asthma medications. One is the metered dose inhalation, MDI. Other one is the nebulization form, nebulized with a in compression with a little bit high pressure with a battery or electric device manipulated drive-in, and third one is the DPI, dry powder inhalation. So patient must be seated upright to have the better inhalation and held by the caregivers. Children, younger kids may be helped by the caregivers. The aerosolized particles must go into the lungs. So nebulizer cap must be worn tightly around the face, around the lips, and then so that every particle goes into the lung. So also the inhalation technique should be done with the respo chamber or a spacer, and make sure that every particle has been properly inhaled into the alveoli. And so to give one puff, suppose in the MDI, metered dose inhalation, so give one puff and ask the patient to take the deep breath and slowly inhale. Before that, make sure that patient has taken 4 to 6 breath, and single breath should last around 10 seconds. And so in older childs you can do it one attempt, a 10 second single breath, and wait for 1 minute, and then repeat for the second puff, and 4 to 6 breaths and 1 minute in the adolescence or the older child, and to make sure that every particle has gone into the lungs. And if some particles go outside the oral cavity and respiratory tract, they will not work. They work less. So similarly with the dry powder inhalation, you have a device. Now it's very cheap, 200 taka something, and there's a cap which should be removed and placed horizontally, and make sure that patient has inhaled fully. Total lung volume is being occupied and exhaled fully. And in between, you can count 1 to 10, and then close the inhalation. That is, enough time should be given for the complete exposure of these particles into the alveoli. So then basically this is the way that one should give. Why don't they give orally? Because oral absorption and a little amount of it will go to the blood, and some amount of will go to the lung. So it will be less effective, and at times high dose and all this and that may not be. Perhaps we may have some tremor and other tachycardia, other side effects. But the problem is that it works less. Give directly. People say that if you keep inhaling nebulized form and DPI, the my son and daughter, they get frequently quick relief. So give in that way, and no other medications left apart from the bronchodilator and inhaled or nebulized corticosteroids are useful in any lung disease except few. So antihistamine, they make the situation worse in asthma, and your no disease in the text has ever been described any medications antitussives available in the market, their usefulness in the lung disease. So so cystic fibrosis you have some one medication, or other lung disease that do not have any anti-cough antitussive medications. So bronchodilator, inhaled nebulized corticosteroid without systemic steroid toxicity, they are the only medications used with the lung disease, cough of the upper respiratory tract. And allergic rhinitis, they go spontaneously. If you give antihistamine, you will get some sedation. You may not have any benefit. So the textbook and the literature, they do not support their use in any respiratory tract illness.